Hi, I'm Dr. William von Almen. I'm an OB/GYN physician here at Touro Infirmary. My primary focus now is gynecology, and I'm here today to talk to everybody about menopause. So menopause is a natural occurrence that all women go through. It can happen early in your life if it is a surgical issue where your hormones are removed, like your ovaries. But it is a naturally occurring process that happens as your ovaries run out of eggs. As they run out of eggs, you stop producing estrogen. And when you stop producing estrogen, then you do not have that estrogen effect in your system. When that estrogen effect leaves, the thermoregulatory system at the base of your brain all of a sudden has to readjust its thermostat. And as it does that, the estrogen stimulation that keeps that thermoregulatory center turned on now turns off, and so your thermostat modification goes away and you begin to have hot flashes. So the hot flashes are something that for most women they will experience for about a year during the menopause. So when does menopause occur? Menopause naturally occurs at an average age of 51. You can oftentimes figure out when your menopause may come by asking your mother or your sisters when they have gone through menopause. Oftentimes you will be very identical to them as far as your times go, unless there are other extenuating circumstances, one of the biggest ones being smoking. Smoking will decrease the time of menopause by the age of menopause by approximately 2 years. Of course, there's other symptoms of menopause besides the hot flashes. There are other what we call vasomotor symptoms like night sweats, where you have to change your bedclothes at night, difficulty sleeping, oftentimes because of the night sweats, but that difficulty sleeping is also an estrogen effect, where the estrogen affects the lack of estrogen affects your sleep center and makes it more difficult for you to get back to sleep. So oftentimes it's easy for you to get to sleep, but it may be more difficult for you to get back to sleep again. And then there are other physical symptoms of the menopause: lack of period, sometimes change in breast size, thinning of vaginal tissues, and also increased risk of urinary tract infections, because the base of the bladder is an estrogen receptive organ, just as the vagina is. So all women go through menopause. It may not be something that is real noticeable. I have a number of patients who will just say, yeah, I just stopped having a period one day and no big deal. And then there are other women that even before that period stops, they will begin to have symptoms as their estrogen levels are declining. Now, the classic definition of menopause is lack of period for 1 year. That means you really don't know you're going through the menopause until you've already gone through it. But you still experience those symptoms as the estrogen levels drop. So what are some things you can do to help make your menopause more comfortable? Well, it's really pretty simple if you think about it. Since the problem is with your thermostat, you want to do things that will not affect your thermostat. So by dressing in layers, you can help things tremendously, because you can take off layers as the temperature begins to warm up. That helps you to kind of moderate your temperature by yourself, not allowing your thermoregulatory center to do that. Keeping a cool beverage by your side is also very helpful. That can just kind of help to cool you on the inside, and so therefore can, once again, affect your thermoregulatory center from the outside, not from the inside, which is what estrogen does. Certain foods can be very uncomfortable for you to consume during the menopause. Think about spicy foods. Tends to make you sweat. And so if it makes you sweat because, once again, it's an exogenous, an outside stimulus that increases heat, that would also help to increase your menopausal symptoms. Some women also complain that red wine, even though we do talk about the cardiovascular benefits of a glass of red wine occasionally, but sometimes the tannins in the red wine are somewhat spicy, and they can also lead to you having menopausal symptomatology because of that exogenous stimulation. Alcohol in general also affects this, and so you should avoid alcohol as much as possible. Relaxation techniques can be helpful as well, whether that is meditation or yoga. Sometimes prayer can help. Those things can do things to help to just kind of calm you down, and therefore certainly help to moderate your hot flashes. Fans, of course, are very helpful. So even though you might feel like you want to turn the thermostat down, having that cool air circulating is really just as important, because that will help to continuously cool your body. Some people swear by herbal supplements, and there are some herbal supplements which can be very helpful. Some that do have a small amount of benefit are soy supplements. That is because soy looks like estrogen and can sometimes plug in to your thermoregulatory center and help a little bit. There's another herb called cohosh, which also has been shown to have some benefits as well. There are several prescription medications which can help. One of those is estrogen. We do use estrogen for women who have quality of life issues during their menopause. Estrogen will replace the estrogen that your body is not making any longer, and it can be very helpful. But once again, it is a prescription, and please check with your physician, because you may have reasons why it would be better for you not to use estrogen. And we don't just give estrogen to everybody because they're having hot flashes. It really has to be a quality of life issue, and it's very much a conversation that you need to have with your physician in order to see if you are a candidate and you want to take the risks. There's another medicine, another class of medicine which we have used for the hot flashes of menopause. And those are drugs that we call the SSRI drugs and the SNRI drugs. Those are drugs like Paxil on the SSRI side and Effexor on the SNRI side. Those drugs have been shown to be beneficial in non-hormonally help the hot flashes, and that would be something that you could discuss with your physician as well. There's another medicine called clonidine, which is an antihypertensive, a high blood pressure medicine that can be used, but once again, check with your doctor. It could lower your blood pressure, and that might be dangerous for you as well. There are support groups also for menopause, but basically, for the majority of women, menopause is something that will last approximately 1 year as far as the vasomotor symptoms go. Some women a little bit longer, and I do have patients who do complain about menopausing lasting the rest of their life. Not nearly as severe as when it first begins, but certainly a hot flash that can turn on at any moment is something which can be very uncomfortable for you. Thank you very much for your time. I appreciate you listening to me and learning about natural changes in the female body. Today we talked about menopause. I'm Dr. William von Almen. Thank you very much.